The expressed views, statements, and opinions by the guests on the Risk Advisor program made either during the show or on the corresponding social media and blog outlets are not necessarily the view or opinions of Baxter Productions, Inc. or any of its affiliates, associates, or others who are part of this production. Information provided during this broadcast is for news purposes only and does not constitute a remedy for any of the discussed risks presented.
Do you have a child or know someone close to you that's been diagnosed with autism? Do you find that diagnosis and treatment options are overwhelming? We're going to try to help today on this episode of theriskadvisor.com.
The Risk Advisor. You're listening to the Risk Advisor podcast. The Risk Advisor highlights topics about the most important personal security and safety issues today. This is for you, your family, and your loved ones. Experts alert to trends, tactics, and techniques used against us. You can be more aware and more informed to stay safe in this ever-changing, complicated place we call life. And now your host, media's go-to guy, Sal Lefriere.
Welcome to theriskadvisor.com. Today we are with Dr. Carol Fiorile, a board-certified behavior analyst. Welcome, Doctor, to the show.
Thank you.
Okay. So, tell us a little bit about yourself.
Well, I am a board-certified behavior analyst, and to pursue that credential, did a PhD program at Teachers College, Columbia University that focused on the area of applied behavior analysis. I have also a license in general education and special education prior to beginning that program. And I'm also a New York State licensed behavior analyst, which is a relatively new credential in New York State and not necessarily pervasive throughout the country. I am a supervisor and administrator licensed in New York State as well. And I also have presented at many different conferences and have several publications.
So behavior analyst, is that similar to behavior modification, or is that two different points altogether?
So a long time ago, it would have been referred to as behavior modification. However, over the years, and predominantly since the 70s, the term behavior analysis has been much more widely accepted. And so what that behavioral intervention protocols are seeking to address are deficits that individuals might have in across many broad areas, including behaviors or deficits in language, et cetera, and so forth.
So it almost sounds like it's a little bit more medical than just the broad term of modification.
Yeah, it actually is very scientific. So behavior analysis is founded on basic principles of behavior that are stemming from animal research previously and then extended to human research as well.
And I know we're talking about autism, but I'm just kind of fascinated by the concept. Would that also have an application to criminal behavior?
Yes. Well, behavior analysis extends to human resource departments as well as criminal behavior, as well as the FBI and shows like Criminal Minds and things. So it does look at the behaviors, any behaviors. So there is a saying in behavior analysis that if a dead man can do it, it's not behavior, everything else is behavior. So we tend to focus on attributes such as appropriate behavior or inappropriate behavior.
So I had spent a good portion of my career working homicide cases and got to, and this is back in the late 80s where profiling was starting to become the norm and became available to us to utilize in cases. And so then later on went into the hostage negotiation team and got to deal with some of the profilers there. And in cases that we were dealing with and situations that we were dealing with, trying to get a handle on, okay, what's the mindset of the person we're with and what behavior is going to trigger them and how do we get them to give up? And that's just the fascination that I have with it. But that's another show. We'll talk about that later on.
Behavior is actually lawful, so you're absolutely right. So looking at previous history of individuals who were taking hostages would be very important if you were going to try to figure out how to deal with the current situation.
Okay. let's get into the actual show of what we want to talk about today, and that's regarding autism. There are many different types of diagnosis, different types of forms. I'm fortunate enough, I don't have anyone close to me that's been diagnosed. I don't have any children, so I don't have to live that nightmare, but I would have to believe that from what I hear and understand and research for the show that it could be overwhelming with the different types of diagnosis. Can you break that down for us?
Yes. So there are children who are diagnosed pretty severely impaired on the autism spectrum, and then there are children who are extremely brilliant and have marked deficits primarily in language. So the span is enormous. Oftentimes there are children who are have more marked impairment who also are non-vocal verbal, which means that they cannot speak. And the diagnosis for many of those children is verbal apraxia, or childhood apraxia of speech. And so that means that their brain is not telling their mouth how to move. And there are interventions that can remediate that problem. But again, the spectrum is pretty broad.
And again, I go back to the topics that I somewhat know. I mean, we used to deal with SIDS cases, and it was a diagnosis to exclusion, right? Is it similar to what we're looking at here?
I think that there are marked areas that one can look at to identify children with autism, and so there are, by the age of 1, certain areas that one would look for, such as does the child respond to their name when they're called? If you say, "Where's mommy?" the child will look toward the mom. Are they able to point, which seems like a pretty basic skill, and yet it's extremely important because it's the first step in gestural communication. And then do they make eye contact? So are they looking at you? Are they seeking interactions with their parents or with their siblings in their environment? If those things are not present, then it's probably likely that it would be a good idea to have an evaluation conducted to determine whether or not there is any presence of autism.
And where does something like that start? Does it start with a pediatrician? At what point? I mean, and again, not having children, not having gone through this, so parent realizes something may not be right. First stop, pediatrician?
Usually that is the first stop, and sometimes with parents, and this is their firstborn child, so they don't have a lot of previous experience in understanding where the child should be, that the pediatrician might be a first stop. In my practice over the years, and I've been practicing since mid-90s, so it's been a long time, I would have had experience with parents who were told by their pediatrician that don't worry, they'll catch up. And if you have any suspicion that there may be a problem, it is a good idea to just have it ruled out then as a possibility, because we do want to implement intervention as early as possible.
And then obviously as the child is getting older, if it hasn't been caught and hasn't been recognized by then looking at relationships that the child may not be making or friendships that they may not be making in the interaction should be a key somewhere along the way.
Absolutely. So is the child playing appropriately? So, for example, some children with autism might like to watch trains and watch the wheels turning or cars, and they might emit what we call stereotypy. So it's atypical movements, like they might flap their hands or flick their fingers in front of their eyes. There's many, many different variations of what we call motor stereotypy. So instead of playing appropriately, they're not really playing with the toys the way a child should be. And it's extremely important, and those skills can be taught, that there be an intervention for the individual, the individuals as early as possible.
Okay. All right, when we come back, we're going to talk about the different types of intervention that are available for persons with autism. We'll be right back.
Workplace violence, terrorism, identity theft, cyberbullying, and stalking. It's not a matter of if they will happen, it's a matter of when. The security world is too complicated to do it alone. You need a security advisor. Call Protective Countermeasures now. Protective Countermeasures has been providing security consulting to Fortune 500 companies for nearly 20 years. Call today, 914-576-8888. BCBA-D, protectivecountermeasures.com.
You're watching theriskadvisor.com. I'd like to remind you that if you or someone you know would be a great guest or have a topic that you'd like us to cover, please reach out to us via our website at theriskadvisor.com. And we're back with Dr. Carol Fiorile talking about intervention and early treatment for autism. So, when we left off, we were talking about some of the issues and problems that we have with autism and how overwhelming it can be. Talk to us about the degrees and deficits in the terms of diagnosis. And just from my part of it, it just sounds like a whole lot of overwhelming mumbo-jumbo. So break this down into English for me.
Okay, so there are individuals who are severely impacted who may also not be able to speak. And so for those individuals, there's a precise program of intervention that would be implemented following the same principles of applied behavior analysis, which is a scientific treatment. For other individuals, they may have much less significant impairment, and so maybe they need help with interacting socially with other children in their school environment during recess, lunch, play after school, maybe even interactions with their siblings, and being able to respond to questions. Because some children, if you ask them a question, and we talk about this term called echolalia, they will repeat back what you just said instead of asking the question. So there's precise methodologies of intervention that can treat that type of problem.
So behavior analyst is something that's relatively new. Started when back?
Well, the first exam was given in 1999 just for a select number of people who are very prominent in the field of behavior analysis. The first exam that was open to the public was in 2000. And so in order to become a behavior analyst at different levels, so let's start with the master's and the doctoral level. At the time, one needed, and one continues to need 1,500 hours of supervised experience under the supervision of a BCBA or someone who has that level of qualification. They have to have at least 5 graduate courses in specific areas of behavior analysis, including specific areas as well. They have to also have passed a credentialing exam. And if you're at the doctoral level, you also have to have either a PsyD or an EDD or a PhD in a related field like special ed or psychology. There are other levels. There's the board-certified assistant behavior analyst, and that is at the bachelor's level with fewer requirements. And there's a relatively new credential called the registered behavior technician, also all part of the board-certified behavior analyst credentialing.
So if you're all in on your training, which obviously you are board-certified, what's the total time, years of training post you so you go to college and get your BS degree or whatever. Post that, how many years of training are we looking at?
Well, I did 6 years doing my PhD at Teachers College, Columbia University. And during that time, we were working in one of the schools that was associated with that particular behavior analytic program. And that was always under the supervision of individuals who were PhD level, also at Teachers College, some of whom were our professors.
So it's very similar to a surgeon or someone along those lines of, the traditional medical fields that we're familiar with. It's similar to that type of time commitment that you're making to this.
It is in some areas, but what has happened over the years is that more and more behavior analysts were needed, and so there are online coursework that is available, and individuals can complete the coursework online rather than going to an institution, and then they are required to secure their supervised experience on their own and seek out other BCBAs who can supervise them.
So someone who's either contemplating using an analyst or wants to be a behavior analyst should actually do a little bit of homework, and like you would do with a surgeon, of someone who's you're going to go to for a surgery, the same level of diligence you should use there, you should use with someone in your field.
Absolutely. And again, you can contact the BACB.com. It stands for the Behavior Analytics Certification Board.com. And on their website, you can find a certificate. You can check out certificates in your area that are credentialed, and they will give you the person's name. You will be able to find out what year they were certified, so you can kind of get a determination about how many years experience they have. And then from there, you can do your own process of interviewing and seeing who would be a good fit for your individual child.
Okay. So let's get into the situation with it. Specifically, we want to talk about autism. There are different types of diagnoses that are made with respect to autism. Walk us through a couple of those.
So the overarching diagnosis has been, over many years, pervasive developmental disorder not otherwise specified, which is PDD-NOS, and that is typically attributed to very young children because they're not quite sure the doctor who you might be going to, the neurologist, the psychologist who is going to give you that diagnosis, the medical doctor. You would have that possibly as an early diagnostic label.
So we talked about it in an earlier show about that particular type of diagnosis, and I think I equated it to SIDS when I was doing homicide investigations, and you had an infant or a young child, and there was no reason for, there were no overt signs of any trauma or blunt force or whatever, that you basically reached the decision of, it was through exclusion. You excluded every possible reason that the child could have been dead, and that then all of a sudden became SIDS, which was in reality a syndrome, really wasn't a diagnosis or a medical cause. Mm-hmm. Is it similar in what we're talking about here?
Maybe in the early stages of diagnosis it could be similar, but there are qualitative impairments, so sometimes children are diagnosed on the autism spectrum too early when they're very, very young, and so it should always be a kind of a question mark diagnosis, but they might just have a severe expressive language disorder, and so it may not be autism at all. So one would be continuing to watch and see how the child develops to determine whether or not they actually are classified with either infantile autism or autism spectrum disorder or autism, plain and simple, or autism spectrum. So
this may not be an easy question to answer, but is there a time in a child's development that would be too early to make that diagnosis of autism?
Generally, children are diagnosed about 18 months. Some students or some children are diagnosed even at a year because it's so clear that there is this problem. And so the earlier the treatment is implemented, the better. But the average, I think, diagnosis is about 18 months. And
the purpose behind that, or reasoning behind that, is that the verbal skills are more developed, or cognitive development is there?
Correct. So the verbal skills should have come in by then. By 18 months, a child should have, someplace around 50 to 75 words. They should be, certainly seeking out their parent. They should be playing with toys. They might even start some representational play by that point in time. So if those things are absent, then it would be a recommendation to seek out a professional who can provide a diagnosis and then get treatment started.
Okay. When we come back, we're going to talk about the processes for securing these services. We'll be right back.
From the files of New York detective Frank Santasola, a riveting murder mystery novel, The Garbage Murders. After an illicit liaison with his mistress, the owner of a private sanitation company in New York is murdered. Enter the life of Detective Frank Miranda, one of a few men in law enforcement to infiltrate the Italian mob and bring to justice some of the biggest names in organized crime history, on Amazon Books in paperback and Kindle editions.
TheGarbageMurders.com.
You're watching TheRiskAdvisor.com. I'd like to remind you that if you or someone you know would be a great guest or would have a topic that you'd like us to cover, please reach out to us on the website at TheRiskAdvisor.com. We're back with Dr. Carol Fiorile talking about the processes for securing services. So, where does one begin? What are the situations we're at?
The first step would be for a parent, depending upon the age of the child. Let's assume the child is 18 months old and they've just been diagnosed, or you're just suspecting that there is a diagnosis of autism. I think pretty predominantly across the country there are departments of health, and parents can secure evaluations that are conducted by speech therapists who are speech pathologists who have a master's in speech therapy, special education teachers, occupational therapists, physical therapists, depending upon the areas of suspected deficit. And so a parent should reach out to their Department of Health in their county, and they should request that their child be given this independent evaluation. You don't necessarily need to have a doctor to make that recommendation. You can, as a parent, indicate that you have a suspicion that your child might have some area of deficit, and you are seeking that organization to provide these evaluations. There are reports generated. There would be a meeting, and the individuals at that individual health department would make the determination whether the child would qualify for services.
So you would go to the health department, not the school?
There's no school before the age of 3.
So preschools, none of that stuff there's no requirements or anything if their kids are in preschools?
Correct. If they're in preschools, the preschool teacher might make a referral, or the child, let's say the child's in daycare, and you might get a referral from the teacher of the class in the daycare setting, or in an early childhood type of setting where they might say, I think you might want to have your child evaluated. And then before the age of 3, you would go to the health department. States vary in the cutoff dates for when the early intervention program ends. So, for example, in New York, it extends even past a child's 3rd birthday if they're born after January 1st. In New Jersey, the children transition to the preschool program in the school district on their 3rd birthday. So it can vary based on your state.
Okay. And so you go to the Department of Health and you explain to them what's going on, and their next step is to get you some form of treatment or diagnosis first before treatment.
Right. They do the evaluations, and the evaluators would determine whether or not there's enough of a delay so that you would qualify for the services. If you qualify, then you would begin receiving treatment by professionals.
It almost sounds a little arbitrary, right? Because I'm thinking, we're talking to someone who is, in essence, a bureaucrat, who's working with limited resources, who's got, I got 100 cases in front of me. I could only handle 50. That bar starts to slide, right, to when that person's going to be able to offer up those services. Is it really definitive points that they have to hit, or is it exactly what I'm saying, where it's sort of a sliding scale, and if you have a lot of requests on the health department at that time, you may not get the service?
So that's a very good question. The evaluators use standardized tests, so there cannot be any discrepancy. So if the child has a certain percentage of deficit, I know from my past experience that it had been 2 areas where the deficit was at least 25%, or 1 area where the deficit was 33%. So then at that point in time, you would qualify for services, and you would get a certain number of those provisions depending upon the area of discipline of that provider with respect to the child's deficit. So if there's just a speech-language deficit, you would get speech-language services. If you have other problems, if your child has experienced, for example, that there's a suspicion that they're on the autism spectrum, you would probably get special education services and hopefully be provided by someone who is actually credentialed in that area. I got to cut you off because I'm just thinking about this is, so you have a child who's 3 years old, and you hear all the time about this, really competition to get into pre-K, right? And parents have to go, the kids have to go for an interview at, 2 years old, for an interview with the school to get into pre-K. If you have a child that you recognize as a problem, you go to the health department, recognize that there are deficiencies, and winds up on,
on a chart that says he needs special care. Does that affect the enrollments in either the pre-K schools or to, I would think, less when you get to real school, when you get to first grade? But does that affect going into the grade, into preschool?
Into preschool. Again, the early intervention is only up to 3. So after 3, you'd be going to your school district and your preschool disabled program in the school district. And so if your child is
if they have like a kindergarten or pre-K.
Well, no. It doesn't matter. It's the program. So the program can be just individual services at home, and it can also be services provided to the child in a nursery school or preschool setting. And those services may be provided by either a special ed teacher, a speech pathologist, an occupational therapist. So they can be provided in that setting. So the school district may not have a class for children who are disabled or considered disabled at that point in time. So you can make a program. So the program is not the actual place the child goes to, but actually the services that surround the program.
So technically, officially, it shouldn't preclude the child from admission to pre-K.
Correct.
But if you do have a child with some cognitive development issues going for an interview as 3 years old and going to some pre-K school or program, that there could technically be excluded from that class.
Technically, they're not supposed to be excluded based on the law, so they should not be excluded because of a disability. So I think that the government has made that abundantly clear through legislation that has been revised over the years.
I mean, I can see the frustration in parents and, having to go through trying to put their kids into a program that, a pre-K program and, start all of the pre-K schooling, and then find out that the school is rejecting them because of a disability.
Well, there may be other schools that they can seek out as well. So maybe not every child gets into every program, but there are other options in your community that there can be sought out in order to make other requests for the child to be included. And then, again, they can be supported in that environment. And the fact is that just putting a child in a preschool program and they're just breathing the air but without support is not going to be terribly effective. It generally does not work. So it's very important that the interactions with the kids be facilitated by professionals in that environment.
Okay. So when we come back, we're going to talk more about the ABA process and how it works. Talk to you in a minute.
Protective Countermeasures has been providing security consulting to Fortune 500 companies for nearly 20 years. Call today, 914-576-8706, protectivecountermeasures.com.
All right, we'd like to remind you that if you have a question or a comment, you can feel free to write us on our website, which is theriskadvisor.com. You should also join us on social media, and you can find all of those links to our social media accounts on theriskadvisor.com. So let's talk a little bit about evaluations and going through the process from 18 months up. Take us through that step by step.
Okay. So from birth to 3, there's the early intervention program, generally through the Department of Health. And then after a child ages out of that early intervention program, there is the preschool disabled program. And in different states and different areas, they're called different things, so I will not say specifically what it's called, but you should be aware that that's the 3 to 5 program. And then there is the transition to the school age program. And so at each step, there is an evaluation process, and at each step, you're meeting with a committee in the school district once the child hits 3 years of age to determine whether or not the child qualifies for special education services. And those would include either ABA instruction or placement in a self-contained class or partial day mainstreaming or integrated collaborative team teaching where there's 2 teachers in the class, a gen ed teacher and a special ed teacher. And those natural processes of transitions from middle school to high school will continue. And each year there is an annual review meeting to determine whether or not the child continues to qualify for special education services.
I can't help but think that somewhere along the way that it just would be a battle for the parents when you're going forward and you're trying to get from step 1 into step 2 into step 3, that it becomes problematic, that you run into a larger pool of individuals that are diagnosed with problems, and then you wind up with a limited amount of resources, and it sort of steps you through. It's a battle every step of the way.
It can be a battle, and the school district conducts evaluations, and they're obligated to conduct those evals every 3 years, and that is the right of your child. If you disagree with those evaluations, you can actually ask for an independent evaluation to be paid for at the expense of the school district. Sometimes you have to evoke your due process rights, and at every one of your meetings, if your child is has been identified with some type of special need, you are given a packet that includes your due process rights. And so at some point in time, you may have to ask the school district, tell them I'm really not pleased with the progress or lack thereof for my student. My child is not progressing. They're actually getting worse. They're regressing. And so I'm very concerned. And so I really need to, have my due process rights. And then you'll go to a mediation, et cetera, and so forth. So
with respect to the due process rights, then it's one of those situations that you need to be well informed, right? What was the commercial that used to be out there? An informed consumer is our best buyer. Where do they get all of that?
So if you're suspecting that there's a problem, you might as I said, have an independent evaluation done, and then identify, there really are problems here. The child is really not progressing, and so there need to be interventions in place, or you might need to seek a private school placement. There are some schools that are state approved that are private, and then there are other schools that are not state approved, and that's more difficult. So you might want to seek some other options besides the public school.
How important is it to bring in an attorney?
Sometimes if you're not well versed, you might need to have the advice of an attorney or an advocate that may not be an attorney, but that has a lot of experience and can guide you in what the steps are in order for you to make sure that your child continues to progress, because we expect progress for all the children, whether it's slow progress or rapid progress. It depends on the level of what the deficits are.
And if you don't go to step of an attorney, because everybody thinks an attorney in lawsuit, and then are we talking about a behavior analyst that could help you with that?
Yes, that's possible if the district is open to suggestions and is willing to implement those suggestions that would result in more meaningful progress for that individual student. Then a behavior analyst might be able to help in that area. And their behavior analysts are generally, for the most part, special education teachers or psychologists. So the services of a behavior analyst might be helpful.
So let's go through in a few minutes of time, but feel free to answer. Take your time answering. What happens when a parent decides that they want to reach out to you? They've identified they need a behavior analyst. They decide that you're the one that's going to help them. And so I'm the parent. I pick up the phone. I call you. I set up an appointment. What should I expect? What should I be bringing?
So the first step is that I ask a parent to sign a release of confidentiality form, because it does not allow me to speak with anyone other than them about what might be the issue at hand. I ask to see a couple of years of individual education plans of their child, the IEPs. I asked to see the most recent set of evaluations that were conducted by the district. If the child is in an ABA program, there should be an abundance of data that I can review to determine whether or not this program has been implemented with with some kind of integrity in terms of the expectations of an ABA program. And then I would set up an observation date to go and see that child at the school program. I might then, I generally do go to see the children at home as well, and I might do some kind of an assessment to determine whether or not I can realize some outcomes with this particular child, so get a sense of who this child is.
Okay. And for parents, if they want to get in touch with you, how do they reach you?
Well, I have a website. It's www.carolfiorile.com. So I will spell my last name. It's F as in Frank, Iorile. And through the website, I would be receiving emails, so you can send an email straight from the website.
Good. Okay. Real quick, 30 seconds.
Yeah.
Got to ask this. When we went to school, we never had any of this stuff, right? We've come so far in where we are. We got to be lucky where we're at, that the education system and where we're at, and to be able to diagnose this has gotten us to the point of where we are today.
Absolutely. In fact, this first special ed laws were passed in the mid-'70s, so that's why when we went to school we didn't have any kids with special needs because they weren't allowed to go to school. So it came on the heels of the civil rights movement, and so special ed people, kids who were identified with disabilities, then were first given the right to actually attend school in the mid-'70s. And so it hasn't been that long, shockingly enough.
Wow, that's crazy. Well, thank you for coming in.
You're welcome.
I'd like to remind you that if you have a question or comment, you feel free to write the doctor, or you could write to us at theriskadvisor.com. Follow us on our social media accounts, and you can find those links at our website at theriskadvisor.com. Remember that you can listen and watch the show also on our website. Once again, we want to thank you for watching, and we hope you tune in next week.
We hope you enjoyed this show. If you have any questions, would like to appear on the program, or recommend a guest, contact us at theriskadvisor.com. Stay safe and join us again next week for another episode of The Risk Advisor.